Good evening, everyone, and welcome to tonight's Power Hour. I am Jenny, a sport therapist, and joining me are our two amazing osteopaths, Maud and Sophie. And today we're going to be talking to you about a really common complaint called plantar fasciitis. So this is something that a lot of people actually develop during like a time in their lives, or have quite significantly for a certain reason. And a lot of people don't realise that it's actually an injury. They think it's just something that they have to maybe put up with. But we are here to kind of educate on what it is. We're going to briefly go over a bit of the anatomy, why it can get injured, and the treatments that you can do at home and what we can do to help you, which sounds good.
Yeah.
So the anatomy of the plantar fascia. The plantar fascia is found on the very bottom of your foot. So if this is like your foot and ankle, it goes from your heel all the way to your toes. So it's a thick layer of connective tissue, which we call fascia. Fascia is found all throughout the body. And I kind of explain it as like a piece of cling film, like a very tight, nice piece of cling film, like on the bottom of the foot, and it basically keeps everything in place. I would say I've been seeing quite a lot of plantar fascias recently. I don't know about you girls. Have you seen?
Yeah, I've seen a lot of them.
Yeah.
It's quite common coming in the clinic, and this fascia, so it basically gets in tension as you walk. So it's a lot to do with your biomechanics of how you're walking, how you're using your lower limb and your legs. So when you have, so like if that's your foot, when you put your heel down and as you get your toe up, that's when the fascia gets really under tension. And if there's any parts that's a little bit restricted, you can increase the tension through that fascia and then start creating little micro tears within that fascia, which with time, overuse and keeping on walking or running on it, you're just increasing this injury and making it worse and worse. So that's what we tend to see it after a long period of time, or you come in pain every time you walk or run. Now it gets really irritated, and you get this sharp pain down the bottom of your foot and up your heel as well sometimes. It can be a really painful thing to get, especially one of the signs, I don't know for you guys, but it's like first thing in the morning, the person say like, my first step is that sit up and walk off the bed are agony, and it's like a limping, and I can feel this shooting pain up my heel and my foot. That's the main thing.
Yeah, I would say the common signs and symptoms are definitely the stiffness and pain first thing in the morning. But they can walk it off, like they kind of say it warms up. And it's always after rest. Sophie is in need. It's usually after rest as well. So obviously sleeping, getting up, but also like if you're putting your feet up of an evening watching a film, then if you're kind of getting up after that, that usually is quite stiff and you need to almost warm it up. But the people that I see that like maybe I'm treating a different problem, like their shoulder or their neck, and it just kind of crops up in conversation that they get like this burning pain at the bottom of their foot, or like this achiness or this pain in either the arch or the heel, particularly if they've been doing a lot of walking and they think this is normal because maybe they've just overdone it. But it's not. This is what we're talking about, this plantar fasciitis. And yeah, I've definitely recently been seeing a lot more because of the marathon. I've had a few marathon runners that have come in where, as Maud was saying, you can kind of have it as an overuse because of your biomechanics, but you can also have it if you are kind of stepping up training and doing a lot more of certain activity or exercise, so like running.
It's poor shoe wear, or like a change in your shoes that creates a sudden change in that foot. So it's increase in the intensity or in the amount of running that you're doing, changes in where you're running. So if you change from like concrete to trail, or trail to concrete, is completely change the impact that going through your foot. And if you've changed or footwear, or if they become really, really old footwears that give you no support and that start to really wear off, those types of feet can kind of trigger off that tension under the foot, can't it?
Yeah, I've had a lot of people have taken up running during lockdown. They've decided that they want to get fit. And I've had a lot of people say that they've decided to try and find their old running shoes in the back of their wardrobe and take those out and try them again. And they go, and they would talk about how when they were in their early 20s, they could run for 15K and it would be no problem. So they decided that they were going to try running for 15K after not running for several years. And then they come in and they've developed that plantar fasciitis. It's very, very common. People get it for so many sort of different reasons. It can be an ongoing issue, or it can just be that you've changed your footwear, you've changed the activity that you're doing, and it then sort of gets brought on like that.
Do you also find that you get people come in with it that say, oh, I've been to the GP or I've spoken to my friends and they've said this is something that you just have to live with. This is something that's going to last like at least a year, which is like, I don't know about you girls, but I find it super frustrating because I'm like, no, it really can be treated quite effectively. Obviously, the sooner the better. If you're going to leave it for like a year or so, then obviously it's going to be a lot longer recovery. But I think with the plantar fascia, if it is causing you grief, if you are starting to notice it, it isn't something that you just have to live with, or it's going to take months or years to recover from. It is very common, and there is a good process that us as therapists follow to get it better quite quick.
There are loads of different treatment options that we would have, and that we're able to do even yourself at home. But I quite like having a plantar fasciitis patient because there's so many different things that I as a therapist can actually do to try and help that. Sometimes if people have a specific problem, it can just be that you've got to sort of treat in this one specific area, doing this specific thing. But plantar fascia is a very treatable problem.
Yeah, so if we talk a bit of like how it would happen, how they would come in a treatment, I mean, you would come in, explain your problem, what you feel like, what's happening with your foot, when do you feel it. We would ask lots of questions about your training if you do need training, or your day-to-day life. So if you're a person that's on their feet the whole day, or if you're doing lots of walking, we would ask about when it comes on, how it comes on, when it's easing off, things like that. So a lot of different questions to try to figure out exactly what it is, because it's a kind of noticeable pain, but it can be a few different things as well. So we want to target the treatment to the best way that we can to find out exactly what's going on. And then we actually have quite a few tests that we can do on your foot to make sure that it is plantar fascia. And I think one of the good thing, we do gait scan as well within like most of the clinic. So that's one of the things usually we ask people to go to get a gait scan, because that really see how much pressure you put on your foot and how's the mechanic of your foot, how much weight you have through there. So that can help us to identify if there's any other problems and how we can treat you. Yeah, you go.
Oh, sorry, I was just going to say on that at the same time, if we don't think, because there are several problems that you can develop through your foot, and if it is a little bit more obscure, and if the pain isn't sort of following that similar pain pattern, we internally in our company, we have people that we can refer for just an ultrasound scan, a diagnostic ultrasound scan where it's the same ultrasound that you use for when you have a baby, but they just do it on your foot, on your heel, up your ankle, in sometimes into your calf as well, and you can get a diagnosis straight there, straight away, if there is that kind of ambiguity in your symptoms.
Yeah, I think just touching back on what Maud was saying, that the gait scan is great for those who, sometimes there are reasons that we can't work out why you're suffering with the plantar fasciitis. So maybe you haven't taken up running, maybe your footwear isn't old. but you are noticing that this problem keeps coming back every time you do a walk. So that is where the gait scan, I think, fits in really well for the people who they've been to see people, they've been to see maybe a podiatrist, they've been to see other therapists, and they kind of give them treatment, send them away, say it's going to get better, and it doesn't get better. Then obviously that's when we need to address the more underlying biomechanical issues, so foot positioning, how you're walking, how you're loading, and that is definitely where the gait scan comes in handy. And it's not just for foot pain. Your foot and your foot positioning and how you load is key for everything in your body. So people watching this might go, well, I didn't have plantar fasciitis, but I had a gait scan for my hip problem or my lower back problem or my knee problem, because your biomechanics and how you load through your body is so important. And if you load slightly incorrectly, that's when you're going to get these issues. So you have the gait scan to identify these, but then what we do is we tailor certain maybe treatments, tailor some strength work to get muscles working around the foot and ankle, but we also have great orthotics which we can prescribe if need be. A lot of the time I find those with plantar fasciitis has a flat foot. So you've got the flat foot, you're in your old unsupported trainers. So instead of getting a trainer that is like maintaining that arch in the middle of your foot, you're just staying flat, and it's not good for the foot.
Yeah, and what you find on checking, like during treatment and things, you'll find that up the calf, the muscles over there are really, really tight. So those ones will be quite sensitive for some people. So as treatment, we work all the way through like the leg, the knee, the thigh, the head. And as a stop, I always go to like the lower back even. So that whole kind of lower limb. We can do manipulation, which are some type of joint manipulation, which we open up the joint a little bit, kind of quick movement through the joints to try to loosen up the stiffness through there. We can do that on the foot. That's quite really effective as well, to do that on the foot to release some tension. And then all the way up your leg as well. Otherwise, it's soft tissue, so working on the muscles, releasing all of that tension through the muscle. And even you do taping as well, don't you? It's quite good for fascia. Sophia, can you do quite a lot?
Yes, I take the plantar fascia so often, but you can also do acupuncture for the plantar fascia. Obviously, discuss that with the patient beforehand, because there are some people that don't like the idea of needles in their feet, surprisingly. But there's, like I said, there's so many things that you can do for it. You know, even some people like to buy the tape at home and tape up their own feet. There's different taping you can have depending on where the plantar fascia, because it's not just like the entire strip of the fascia is affected. It can be that there's more specific areas that are worse than others, so you focus the tape on these areas to give a little bit more support. Some people find it really helpful when they want to go back to running after having the plantar fascia. They're beginning to feel good, but they're a little bit cautious about actually trying to run again, and they just want that extra support basically there to help them get through it. So it's really effective treatments that you can do for it. There's loads that you can do.
I'm also going to chime in with my favourite treatment of shockwave. I feel like all I do at the moment is talk about shockwave. Shockwave is awesome. So if you are that person that has struggled with it on and off for years, or you've had it for over a year, because people say you just have to live with it and it takes a long time to recover, you're now what we call in a chronic condition. So an acute condition is where maybe something's just happened, you've just got the injury, you've got loads of nice inflammatory cells going to the area to kind of start the healing. Whereas chronic is almost like your body's forgotten about it, there's no healing stuff going on, it's not doing anything, it's dormant. But it's still sore and causing you a problem. So that's where the shockwave is most effective. So what it does is it tries to bring this chronic injury back into an acute state. So it is meant to be a bit uncomfortable, the treatment, but I mean, I've had plantar fasciitis, I've had shockwave done, and like when you go to bed, it feels like you're walking on clouds. Like it feels great afterwards. And I would highly recommend it. So many people I see come in with this chronic injury, they don't think it's going to get better, and after just a couple of weekly sessions of shockwave, their pain levels massively reduced, and kind of back functioning properly, not limping, not being able to go out and walk the dog because of it being sore. So do you guys have any tips for like what patients can do at home, like to try, let's say they've just started running or walking, they notice that they've got pain in the bottom of their foot, they maybe don't want to come and get it looked at straight away, they want to see if they can help themselves first at home. Is there any kind of top tips that we've got for them?
Absolutely. So a common trait of plantar fasciitis is that burning sensation, that burning pain under the bottom of your foot. What I like to do as well is just adding a bit of self-massage to the arch through that fascia. I encourage my patients to get just a plastic water bottle in the freezer with water in it, get that ice on there, and then you can roll your foot on that plastic water bottle. So you're getting the relief from the ice, but you're also getting that self-massage technique, and it's normally very, very soothing for people. On also just getting something like a tennis ball. A hard ball will be probably a little bit too intense, a bit too painful, but a tennis ball has just enough give and bounce, so you can give yourself a nice bit of self-massage all the way through your foot again. Stretching through your calf, trying to do some gentle heel movements, exercises, so that you're getting all that flexibility, nice fluid flow through there. Anything else that you have, Maud?
Definitely what you said with the ball under the foot, but as you said, self-massage as well. I tend to show them good self-massage technique, kind of using your fingers to really work through the foot. Also a little bit of kind of mobilization of the ankle, so just gently before getting out of bed, before standing up after that, sitting for a long period of time, starting to move the joints a little bit, starting to get the blood flow going, a bit of stretching through the ankle, just to warm up and wake up all of these muscles and this fascia, kind of as a start on, okay, I'm going to put weight through you. Just, I'm warning you, weight is coming and pressure is coming. So it's just kind of warming everything up a little bit. And I'd say probably there's a bit of rehabilitation and training that you want to work through after getting better. So as the pain decreases, before getting back into your full-on running and your 10, 15K, you want to build it up. So you want to start again from a lower amount of exercise and then slowly build it up again. And that's going to be very gently and stage by stage to not go backwards back to this injury and back to this fascia being tense. So there's lots of strengthening exercise that we can work through, lots of balance exercise as well that work all of the tiny little muscles through the foot that are really, really helpful, especially if you're running on trails and things like that when the ground's not really even. That helps with your balance. So yeah, there's lots of things that we do, but main thing is if you get feeling better, don't go directly to your 10K again. Start with like a 3K, then you go up to 5, and slowly start going up to where you were, rather than just wanting to directly go to where you were.
The only other thing that I would have to do at home, calf stretching is key, because obviously everything's linked. A lot of people always ask me why am I stretching my calves. It's all linked, so we need to keep everything nice and loose and happy. But also a good plantar stretch for the bottom of your foot. So if you are up against a wall, this is your foot, try and get your toes up against the wall, and then just trying to push your foot down, so you're trying to stretch through the bottom of the foot. This, maybe you won't get it if it's more of a kind of chronic injury, but if it's like an acute injury where it's quite inflamed and it's sore, then you should get quite a nice stretch going through the bottom of your foot when you do that. But yeah, I'm the same as Maud. We need to make sure that we can get you back into what you want to be doing activity-wise. And it isn't just running, it's not just for people who are sporty or are doing a lot of exercise or activity. It's just people like who want to go walk around the block. Like they started it during lockdown, they want to continue doing that. Maybe you've got a dog and you want to be able to walk that for a bit further. So it is for everyone, we need to make sure that, as Maud was saying, we gradually increase your load so that it adapts, so that it becomes happy to what load is being placed through it, and you can kind of keep increasing everything until you're at a level that you want to be, and everything should be happy. But I would say it is super common. It is something that can easily be treated. If it is something which you are struggling with, we would recommend doing some of the exercises that we've given during this talk. Try the ice bottle rolling, very good, definitely. That helped me a lot. But yeah, I would say give those a try, settle it down. If you're still struggling, if you can't do any sort of running or walking because it's just too sore, book in with one of us. We've got Cambridge, we've got Hertfordshire, we've got London clinics, and we're all very hot on plantar fasciitis.
Yeah, and if you have any questions, just down below in the comments, and we'll make sure to get back to you if there's anything that's kind of burning to ask and really want to know about. Don't hesitate.
Perfect. So on that note, make sure you tune in with us next Friday, because we are moving from the ankle up to the wrist with carpal tunnel problems. So we will see you then.
See you, everyone.